I can't actually manage the chat and writing and presenting, so I'll just leave that.
Leave the chat to me. Don't worry. All you need to do is
Okay.
present, and I'll do the chat and record. So you just talk to your slides, yeah, and get started.
Great, thank you, and thank you very much for the invitation. I joined the meeting earlier, and it was a very very exciting meeting to join. There was a lot of energy and a lot of positive energy, so I definitely enjoyed that. I was invited here to talk about school non-attendance among autistic children in the UK. It's a project, well, it's research that we've been doing with a number of partners across the world over the past 5-6 years. And I will be presenting today findings from a study we did in the UK pre-COVID, but then I'm also going to be talking about what we are currently doing, which also involves some work on the impact of COVID. And for that work, the Council for Disabled Children is a partner. Sorry, I forgot to introduce myself. I am an academic. I work at UCL. My field is developmental disabilities. I do quite a lot of research with families and children with learning disabilities and autism. Okay, right. So what do we know about school attendance in autism? We know that in the UK we have the DFE that until very recently, as in pre-COVID, was publishing some national statistics every year. And when you look at the statistics across a number of years, you see that the rates of absence are higher in special schools or where children are identified as having special educational needs. And there was some qualitative research earlier on that suggested that school attendance, as in going to school and interacting and experiencing school, might become more difficult when you have special educational needs that include difficulties in social interaction and social skills. And so these difficulties are both at the core of autism, the definition of autism as we understand it, but they are also at the core of daily life in a school. So you can see where the interest in studying school attendance or school attendance problems in autism emerges. And actually, when we look at research effort across the world, we see that it is very, very limited, or at least it was quite limited up until very recently. And of school attendance problems, the only thing that had been studied to some extent was school refusal. So where the child refuses to go to school. And we had a study from Japan and another one from Norway more recently, and they studied school refusal among children who were either autistic and had a learning disability in Japan, or who didn't have a learning disability in Norway. And they found in general that levels of school refusal were high, especially where they compared it to students without who were typically developing. And differences emerged whether it was the parent reporting or the teacher reporting. So what we wanted to do with our research was to provide a more comprehensive description of school non-attendance among autistic children in the UK. There are other types of school non-attendance problems, not just school refusal. So we wanted to describe this more systematically using a tool that is called the SNAC, and I'm going to talk a little bit about the SNAC later on. And we wanted to begin exploring groups of students that may be more vulnerable to missing school or different reasons for missing school. So in March 2017, well, actually, no, it wasn't in March 2017. We launched a survey where we invited parents of autistic children to let us know about their child's school attendance during March 2017. So for every day of that month, we asked the parent to indicate whether the day had been missed, whether the child had gone to school or not. And if the child was absent, we were asking the parent to indicate the reason that the child was absent. From a list of reasons that are presented in a questionnaire called the SNAC. We had 486 respondents take part in the survey, and about 96% of them were mothers, and about half of them were educated to a degree level and in paid employment. So you can get a sense of who were the participants in this study. The children for whom they were reporting were approximately 11 years old. Most were male. About 20% had a learning disability. Intellectual disability is another term that is used for the same condition outside the UK. About 80% attended a mainstream school, and about 75% lived at home with two parents. So there were two parent carers in the household. How did we define non-attendance? Three ways: whether the child missed one day, a specific day or not. We counted the total number of days that were missed. In March, there were 23 possible days, so a child could have missed anything between 0 and 23 days. But we also looked at persistent absence, and that is missing 10% or more of available sessions. So in March 2017, all 23 days were possible school attending days. So we counted who missed 10% or more of that. And the reason this is important, so the reason 10% of missingness is important for our study, comes down to two things. The first is that this is how problematic absenteeism, if you'd like, is defined by the Department for Education in the UK, but also by the equivalent Department for Education in the States. They call it chronic absenteeism. And also the fact that there's research evidence that suggests that missing school at that level is associated with an increase in the chances of dropping out of school by about 30%. And as you know, dropping out of school is in turn associated with a number of negative outcomes for the young person in terms of their life chances and so on. So what we found is that 36% of children didn't miss any school. The mean number of days that were missed was 5. But 43% of children were absent for over 10% of the time. So they were presenting with persistent absence. And then we looked at what child, family, or school factors may be associated, may be linked to school non-attendance, which we defined in those three ways. And we had a number of factors that we examined. But as you can see, it was very interesting that it was the same 4 factors that emerged as important, regardless of which way you look at non-attendance. And this was child older age, not living in a two-parent household, parental unemployment, and attending a mainstream school. To get a sense of the findings, attending a mainstream school increased the risk of non-attendance by about 100%. Living in a two-parent household increased the risk of non-attendance between 37 and 75%. Similar increase in risk was associated with living in a household where the parent was not in paid employment. And there was only a very small increase in risk of not attending school if you were older, so about 7 to 8%. I told you earlier on about looking at the reasons for non-attendance. Now, there are different ways to describe types or reasons for non-attendance, if you'd like. And those reasons, the typology, if you'd like, differs from country to country and from context to context. So whether it's the Department for Education, schools, or researchers, this is quite, there isn't a systematic way because it's a very complex and difficult phenomenon to capture. But this measure was developed to try and capture every possible reason for school non-attendance. And then it groups the reasons depending on what they look like, but also who is instigating, if you'd like, the non-attendance. So I'll start from the bottom. It talks about non-problematic absenteeism. Now, the term, you'll probably agree, is not a good term, but what it captures under that label is absenteeism that is linked to poor health, being poorly, having to go to a doctor, having to go to an appointment, a developmental appointment, if you have special educational needs and so on. Then we have 2 reasons that are where the non-attendance is instigated by the child. Yes, you put me on the spot. I think it stands for a school non-attendance checklist. So the two instances of non-attendance where the child is instigating are school refusal and truancy. So truancy, as the term is fairly clear, the child doesn't go to school. It does so without the school's permission, and it does so usually trying to conceal the absence from the parent. So the parent isn't aware of that usually. I've got a couple of examples of snack items on the slide. School refusal is where the child doesn't want to go to school. There's a lot of emotional distress associated with going to school. And absence happens despite a parent's reasonable efforts for the child to go to school. School withdrawal, on the other hand, is absence where the parent, it's initiated by the parent, and it's the occasions where the parent is keeping the child at home for other reasons. So you see an example there. School exclusion is the final category, the final type of absence that SNAC captures, and it is it's absence that instigated by schools. It's where the school either puts in place disciplinary processes where the child, has done something and the sanction is that they are excluded from school, or other instances where the school is discouraging attendance because they don't feel that they can keep the child safe, or they don't feel they can respond adequately to the child's needs. So when we looked at reasons for non-attendance, so the study was carried out across the UK. We had participants across the country. We saw that school refusal was the most frequent reason for missing school, with 43% of days missed because of school refusal. Then we had non-problematic absenteeism as the second most frequent reason. Then school exclusion and school withdrawal, each accounting for 9% of the days missed. Truancy was really non-existent in this sample. But this could be related to how we did the study, so to the method that we followed, where we asked the parent. So then we wanted to understand a little bit about students who miss schools for these different types of reasons. Who are these children? Who are their families? What is the type of school that they go to? And actually, we found overall very little information to describe those groups of students. So school refusal was more likely in older children. What SNAC calls non-problematic absenteeism was more likely when the child has an intellectual disability as well as autism. And you can understand how this might be the case where there are more than one developmental disabilities present. We may also have physical health problems present, and so on. Students who were excluded were more likely to come from single-parent households where the parent was unemployed and had high levels of educational qualifications. So a profile that points to the family more, although attending a mainstream school was also marginally non-significant. And school withdrawal was a reason for non-attendance that was not associated with any of the factors that we examined. So to wrap up, when we look at non-attendance across the board, we see that going to a mainstream school is associated with higher chances of missing school. 4 in 10 days lost are lost because of refusal. So refusal is likely a significant issue in autism. And from the way we define school refusal, we can see that there must be a clear link to mental health difficulties. And we know that mental health difficulties, and in particular anxiety, are elevated among autistic children and young people. But unfortunately, we hadn't measured mental health problems in our study, mostly because we wanted to keep our study brief and manageable for parents. I've already said that the non-problematic absenteeism was mostly about health issues, and that children with more than one developmental disabilities might be more vulnerable to this kind of absenteeism. Now, in terms of school exclusion, our data didn't indicate that much, but there are some qualitative studies that suggest that where we have exclusion in this population is usually resulting from a poor match between need, perceived need, and what the school can offer or how the school can adapt around the child's needs. And these needs are not the same for all children, clearly. So what we are getting out from this study is that there is variability in reasons for missing school in autism, and also that we are not getting much information from the current data on who are the children who are more likely to miss school for the different reasons of missing school. So where we are now, we are analyzing data from another group of children with a developmental disability, learning disability, intellectual disability, half of whom are also have also autism, from Australia. So it'll be interesting to see not just the country differences, but actually whether the findings are replicating to a certain extent. But it's important to note that these children are predominantly from a special school background, so we are expecting some differences. And I can say that one of the things that was emphasized quite a lot in one of the presentations this afternoon by Nick Whitaker was the issue of the school family relationship. I've seen the preliminary analysis from the Australian data, and I think that's one of the factors that's coming up as important, which we hadn't measured in our first study in the UK. The other thing that we are doing, we are currently in the middle of data collection for a study that is looking at the impact of COVID-19 on the educational experiences of children with learning disabilities or autism or both conditions, and any other developmental disabilities they may have. And this time we're interested in capturing data from children who are registered to go to school. So we are again asking parents to let us know about school attendance, this time for May 2021. Their experiences of homeschooling during the lockdown that we had sort of post Christmas this year, parent satisfaction with these arrangements, but we are also gathering data on child mental health and family life. And this time we want to hear more from parents who are educating their children at home, if they have taken them out from school recently or whether they have always been home educating. We are asking about the education arrangements at home, how education is organized, how satisfied parents are with those arrangements. And again, we are gathering data on child mental health and family life. You know, the incentive, if you'd like, for this study started from the fact that there was a lot of unease, last summer. These headlines are from last summer, a time when we were trying to make sense and starting to analyze our Australian data. And also we had this, we were making sense of the study I just presented to you in the UK. And we saw that COVID, apart from the fact that it caused a lot of disruption in children's education, it was reported that it might have led to a number of trends that were associated with the lockdown measures. So, for example, the compulsory return to schools in September caused a lot of anxiety among parents. There were a lot of anecdotal evidence that elective home education might be increasing, especially among children with special educational needs. So there's definitely an imperative on gathering data around the experiences of schooling and home learning for this very vulnerable group of children. I don't really know how much time we have, but I intended this to be a workshop. So I really wanted some time to discuss things, either your reflections on the findings of our research so far, or your reflections on the impact of COVID on school attendance, school refusal, or elective home education. I'm particularly interested in what you think about any longer term trends. A journalist asked me that 2 days ago, whether what started off as a unease or anecdotal evidence and stuff like that might become a longer term trend about children's reluctance to go to school because of anxiety, but also parents or children being taken out of school to be home educated for whatever reason. So yeah, very interested to hear from you, and I'm hoping Anna might help me.
I will, absolutely. We have plenty of time. We have another 20 minutes, so we can use that if people want. I can see that Charlotte has popped a comment in the chat about getting increasing requests for autism school refusers to receive tutors at home. So as the research on key factors of school attendance success. And then there's a few hands up. So do you want to, why don't we, I'll ask the others who have questions and we can take them all kind of. And someone says they're also seeing that. So Sue, your hand's up.
Hi, that was really interesting from my perspective. I'm the DCO for Kent and Medway, and we're certainly seeing some of that trend that's been mentioned by Charlotte as well, about increasing requests for tutors for home, and the anxiety levels of children with autism accessing mainstream settings. For me, it'd be really interesting to understand, because obviously your research is saying that when they're in a mainstream school, they're more likely to have that non-attendance, and yet our whole ethos is around inclusion. So, you know, how are schools going to address that? Because actually, you know, inclusion and nurture, I think, is one of the top things that we should be embracing. And this gives you even more evidence that we should be doing that more robustly, because I'm not sure we're doing it as robustly as we should at the moment. I don't know whether anyone agrees with me, but yeah, it's definitely an increase.
Thanks, Sue.
That's interesting. I was looking, some of you may have noticed there were some data on attendance that were published by the DFE yesterday, and it's very headline level data on different types of school environments and attendance levels, overall attendance levels. And the provision, the type of provision with the highest levels of non-attendance were alternative settings. Typically, before that, it was special schools that had, you know, the lowest levels of attendance, but this time it's alternative. So I'm sensing from your comment as well that there is going to be increased demand for, you know, that we did see that trend in our data in 2017, that a lot of people were finding that a good solution was to have online schooling at home. I am getting a sense that a lot of alternative online provision is going to be requested. Now, in terms of how do we keep children at school, I really don't know. It is going to be a very, very big challenge. And one of the things I'm thinking about is that we don't really know how the current catch-up plans are considering children with special educational needs in mainstream provision. So that's one thing. Second thing is, do schools at the moment know how, under what conditions they're going to be operating from September? I expect that a lot of parents, especially parents of autistic children, will already be thinking about that.
I think there is a significant concern around the part-time timetables. And I think you highlighted that in that persistent absence type thing. But there is also that school side of things where they implement a part-time timetable to supposedly support them, and how that's monitored is, I'm not going to say too much because I'm not the education part of the group, but I know that it's not monitored effectively in our area.
Laura, do you want to come in?
Oh, hi. I think, you know, echoing a lot of the things that Sue was saying, and it's this issue is particularly big for us in County Durham, and we've done kind of a task and finish group recently on it. And what I've noticed is that I'm at the SEND panel where we assess EHCP requests, and I'm monitoring now all of those young people who are coming through who are not attending school due to, you know, whatever reasons. Basically, it would be your kind of school refusal, but anxious about school is how we phrase it. And what was interesting is just the sheer numbers of people with autism you know, for us, for what I've done from my audit at the moment for this year, it's 100%. You know, there is nobody that isn't autistic or has autistic traits or is waiting, you know, for an autism assessment. And I guess the thing for me, and also we're working with a school attendance service, so the school attendance officer is actually asking the questions when they're picking up the phone and talking to parents as well. And I think that it's really important to capture that data. I think for me, in the here and now, I kind of, and sorry, the caveat is that when they get to that panel where they're requesting an EHC, they've already not been at school for 2 years, you know, and I often, you know, the horse feels like it's bolted, and I just wonder, and I guess it's more really for the forum, you know, rather than yourself, but what we can do, you know, there is something about, we know that, and actually, what can we learn from the qualitative data? What can we learn from the parents, the carers, and the young people that have been interviewed in the here and now that we can implement as of September? What do we absolutely need to do differently in the short term, as well as the medium term and the long term? So anyway,
Thank you.
That was my
and
reflection.
I think Ella's made a point in the chat, which I think probably speaks to yours around how health can support. Think about CAM's support to, you know, what's the pathway of support pre statutory plan, if you like. So yeah, lots of agreement there.
If I could just make a quick comment. You did ask a very big question. I'm not going to pretend I know the answer, but I ran a similar workshop in the Netherlands earlier in the year. And I'm just going to relay something that I thought was very, you know, they've got school refusal regional teams looking at all the schools and stuff like that. So one of the things that they said would be very important is to clearly early intervention, to start at primary and to start before you get identification of you know, need. So wherever you identify that there are some school reluctance issues, to start intervention at that stage before it escalates. One of the things they pointed out is that a number of their teachers confuse school attendance or confuse school refusal with autism. And you know, it's important that teachers are able to more confident in identifying where a problem is school refusal, and it can be addressed at that stage without necessarily, you know, sending a child for you know, further assessment or hinting at autism. So I suppose that it is both a short-term and a longer-term solution to addressing problems with non-attendance, but you know, it doesn't really address the main issue of how do we go on to address current problems in secondary schools, which are going to be far more pronounced than primary schools, I think.
And I can see Anne has written a comment in the chat about a piece of work supporting schools to recognise and work with families if the early signs of school refusal have been identified. So Anne, I'm not sure what area you're from, but that sounds really interesting. And Sue makes a very valid point about mental health support workers in schools. A few more hands just to let people share their point. Natasha, you're next.
Hi. Yeah, I just it seems to me that I sat in panel yesterday and we talked about 6 cases, I think, and if I remember correctly, at least 3 of them were to do with young people with autism who were effectively stuck in their bedrooms. So I suppose it's school refusal from the way you're talking about it, but just really struggling with the system and kind of thinking, how do we get them out of the bedroom? And in fact, we've got one very, very complex child who had a nasty incident in going back to school in September and is just sort of closed down completely and won't leave his bedroom. So just along the spectrum we're talking about, but the sort of more severe side of it. And yeah, just really difficult because, I mean, I know one of them we're just spending an absolute fortune on. Trying PBS and, you know, all kinds of things. And, you know, I think actually 2 of the ones in panel yesterday were in our hospital special school, where the environment is smaller and they don't really need to go to a special school in terms of their learning disability, but will they really fit into a mainstream school? So it's a challenge, yeah.
And I think a couple of comments in the chat about some of the sensory needs, and actually bubbles and smaller, learning environments during COVID and less moving around actually was beneficial to some children, and that suited their needs better. So I guess there's two sides of the coin, aren't there?
Yeah, I mean, I think one of the genuine research questions we have through the data that we're collecting now is which way is the direction between mental health, anxiety, if you'd like, and school attendance. Not every autistic child, gets anxious at the thought of attending school. There were people who were reporting that anxiety increased because the routine changed, schools closed, or there's disruption in the routine, and there were people for whom anxiety decreased because they could stay at home and the environment was much more manageable. So it is a genuine question. I don't really know how it goes, whether it's a uniform phenomenon. From what you're saying is that the people that you are seeing are there because they don't want to go to school because of higher levels of anxiety. They are the ones reaching the panels.
Yes, that's correct. Yeah.
Mark, oh sorry.
Yeah,
Mark, go ahead.
Yeah, I'm quite interested in lots of this conversation because I think, like most people, we've been getting a lot of children and young people that have been isolating in their room, and there's loads of people involved in them, sometimes not even hitting the CAMHS threshold for whatever reason that might be. And we often talk about those underlying health issues, and I'm thinking, what are they? And what is the issues and the health issues we're talking about here? Because what is the fear underneath this? They talk about anxiety, but there's a fear underneath that people struggle to get to, because those children almost like protect themselves in a way that shuts them off, and it shuts them off out of society on the whole. If I'm honest, we've had a number of children that have gone through the care education treatment reviews where they've actually been similar types of presentation. We've also had children that are under, if I look at our medical needs, because I work quite closely with our medical needs services, you would get a high percentage of those within the medical needs accessing from the education system that have got ASD, because they have difficulties around accessing education within the school setting. And I think this is a real biggie, and I'm not quite sure where it all fits, if I'm honest, because I don't think it can be in isolation around the school. Because I think the school is one element to that child's life. Home is also another element to that child's life. And I'd be interested to know the ones that have got ASD, that are attending school, what is different for them and how have they got to be in school? Because that's the bit that I think we need to get underneath, because sometimes there's some clear things that are happening for those children that is helping them to be in school and being supported, but there's some children that it isn't. And I don't know how we can put confidence in the system for the parents to have their children to go into school, but there are some schools that I think struggle in those adjustments to support those children, where there's some schools do it really well. And I think the secondary bit that you talk about is quite an important one, because I think that becomes quite chaotic for children with an ASD presentation when they go into a school environment that's constantly moving and constantly changing to different lessons and stuff like they do. So I think there's an element that actually we need to consider what those children needs are and how we offer a different type of educational service to those to prevent that type of fear and worry around the overstimulation that goes on for them. Because I think we could avoid a lot of the anxiety and distress if we made some differences for them, because it actually sometimes it's about their presentation of how they actually are, and we need to work with them how they are. Does that make sense?
And what counts as a reasonable adjustment, I guess.
Yeah.
Thanks, Mark.
Yep.
So we've got a few more minutes, and I can see, Lindsay, you've had your hand up patiently, so I'll let you you ask your question or make your reflection, and then we'll do a bit of wrap up.
Hello, thank you. Yes, I'm Lindsay Malexal, DCO for London Borough of Bexley, neighbour to Sue, who spoke earlier from Kent. So thank you very much. It's very helpful to have the academic research to associate with what we're experiencing and doing locally. So we've looked at it. We know that of our current children, 2,400 with education healthcare plans, 1% currently are having difficulty in attending school on the more than 10% basis. And we're going to be looking at children at SEN support level and those without. So of those with education healthcare plans, we know that most of that group have autism, and there are some, most are older than 11, mostly secondary age, and a few primary. I think from listening to the discussion from everyone, we have very sort of similar contexts in that for some young people, it may be an anxiety about school and inclusivity of that school, but for others there may be one or more factors, and then also sometimes the longer the absence from school, you have further factors. And I think what I'd like to ask is there any research that you know of, or would you be looking for local areas to participate perhaps in action research on what is effective practice for this group of young people, particularly some of the teenagers? I think what we're seeing is that we have support, but it's in different places. So that team around the child is having to be pulled together from, a bit from CAMS, a bit from SEN services. We don't have a lot of occupational therapy that could go into the home, work with the young person, and that support for the parent as well, where patterns of behaviours have developed, and mesh dynamics, these sorts of things. So it'd be great to know almost the what next of this research, and so that we can get some good service examples across the country.
Thanks, Lindsay. That's a very helpful final question.
Yes, and a challenge for us actually, to move to that next stage of being able to, test out supports, interventions. And I have to say that we don't have any concrete plans at the moment, but that is ultimately our longer term plan, is to understand, describe, and then look and test for solutions. What I would like to say is that I am, there is this question around, what else is going on that is contributing to school refusal or school non-attendance. I'm getting a lot of, I'm getting the sense that, yes, we do have this disruption with COVID now, but if it is going to be an association with mental health issues, I think you're saying that, there are broader issues that need to be looked at. And even though we didn't measure that in our first study in the UK, we're not finding a lot of association with mental health difficulties of the children in the Australian data. So mental health isn't going to be a big one, I think, necessarily in us trying to understand how we need to support this. One of the factors that is emerging, and I think it is going to be, we'll see whether it emerges again in the UK data, is the issue of school family communication and the issue of school family relationship and the perception of the parent of what that relationship is. Clearly, it is easier to establish a relationship with a parent, in primary school level than it is in secondary because of the way schools are set up. And I think special schools are, sort of more like primary schools. But I will effectively say that we don't really have any recommendations for solutions at the moment. We are still searching, and I don't necessarily see mental health problems being the only part of the jigsaw when we're trying to understand this phenomenon. And I agree with you, it is a very complex phenomenon, and it's not just about the child, it is about the family, and it is about the wider context as well.
Thank you. So we are out of time. You're supposed to have a 10-minute comfort break between this and your next. No, don't worry. It's such an interesting topic. So yeah, a comfort break between now and the next workshop, which starts at 3:50. Vaso, would you be happy that we share your email address? Would that be all right if people have further questions or practice that they'd like to highlight?
Yeah, absolutely. And my slides, if
Yeah.
you know, if you have a mechanism for slides,
Absolutely,
it would be
we'll do
great.
that.
I've got the recruitment slides as well. Thank you very much. Thank you.
Well, no, I'll share the slides, and thank you everyone for joining in, and yeah, I think conversation to keep going. But yeah, go get a cup of tea, and next workshop at 10 to 4, you'll have an invite in your calendar. Thanks.
Thank you very much, everyone.
Bye. See you shortly.